morning and welcome everyone to today's webinar. By way of introduction, I'm Anne Livingston, the Chair of the Expert Reference Group for the Queensland Government-funded Community Care Smart Assistive Technology Collaborative. I will be moderator again for today's webinar on outstanding delivery of remote services through technology and innovation. This webinar is part of a series of sessions being facilitated by Community Resourcing for the Community Care Smart Assistive Technology Collaborative. These webinars have been designed from feedback and requests we have received through the collaborative, and particularly today's session is focused on our interest around rural and remote service delivery. Our webinars are bringing together local, national and international perspectives in research and development, as well as focusing on the deployment of smart assistive technology in the community care sector specifically. Many of you will know that Community Resourcing has an extensive international linkages, and we've been fortunate to work on many international and national projects with a number of research entities and service providers. And we have award-winning, published and recognised projects. Those of you who have attended previous sessions know that we have been funded by the Queensland Government to bring together an online platform for community care service providers who are interested in collaborating on issues and practices related to the adoption of smart assistive technology. This site is accessible to all and is free to register. If you already haven't registered, I encourage you to formally register for the site, and this will allow you to get all our information that comes out weekly. In today's session, we're also introducing closed captioning, and I'd like to welcome Sandy from Reporters Inc., who is behind the scenes undertaking this, this task for us. By way of disclaimer, please note that neither Community Resourcing or the Department of Communities, Child Safety and Disability Services, through these webinars and through the work of the collaborative, we are not promoting or endorsing any particular product, research entity or organisation. Rather, our webinars have been brought together to inform viewers of examples of various smart assistive technologies that are currently in development or in deployment. Bit of housekeeping at today's webinar. As attendees at today's session, and in the interests of recording, we have muted your microphones. But we encourage you to ask questions, and in other webinars we've been inundated by these questions. These questions can be added to the question pane on the dashboard to the right of your screen, and there will be an opportunity at the end of the session to have these answered. Please post early, and that will ensure that we can address your issues during today's session. In today's webinar, we have two exciting speakers. Julianne Lambourne, who's the CEO of enVizion, and David Swayn, the National Disability Coordination Officer for the STEPS Group Australia. Both of these people work collaboratively and are here to discuss how they are providing outstanding and unique remote services using technology and innovation. I'm going to firstly introduce Julianne, and then Julianne will present, and then I'll welcome and formally introduce David to today's presentation. So welcome firstly, Julianne. Julianne has been working very collaboratively with us through not only our collaboration but various events, and Julianne is a fellow Queensland Community Care Community Digital Champion appointed by the Minister of Innovation, Science and the Digital Economy and the Minister for Small Business. Julianne, in a day job though, is CEO of Cairns-based not-for-profit enVizion, and they showcase their regional, their use of virtual reality technologies and multimedia that inspires users to imagine a career in construction, mining, agriculture, health or aquaponics. She also shares the outcomes from a project that involves environmental healing, therapeutic delivery, as well as language literacy and numeracy learning on country in Cairns and surrounding areas. Specifically, this service is aimed at supporting people diagnosed with mental health concerns. It's our real pleasure, Julianne, to welcome you back to today's session.
Thank you, Anne. Appreciate the opportunity to come and share what we're doing on our journey up here and also across Australia as well. Today I'm going to talk about a couple of things, as Anne has said, about how we combine digital innovation in programs that affect people across various different areas. We are an Indigenous organisation, but we do work with all people that have a need, and that has come from starting with Indigenous people and then having a lot of other referrals of people coming through that all have needs. So we're really excited about the opportunity of working with all different people, and we absolutely love them all and what they do and they bring to our organisation, and how they even help us change the way we view life, trying to see through their eyes as well, and how they view the world, and it's an exciting place to be. I'd like to talk to you first about a program that we have, Partnerships and Prosperity, and this program is really set up for people who are severely disadvantaged, whether they're struggling with mental health, homelessness, addiction. In particular, this program was delivered in a small community called Yarrabah. Now, Yarrabah is about 45 minutes from Cairns. Even though it's very close to Cairns, it still is considered a very remote community because of the lack of opportunities that are in the community, and some of the people who live in Yarrabah haven't driven the 45 minutes and coming over to Cairns, so they do live in a remote but extremely beautiful location on the seaside. We were invited in to do a part of the program which included environmental healing, and that is where we reconnect people back with the land and the sea. And we do this in partnership with language literacy and numeracy. We've found with combining environmental healing, everyone would assume that people, especially Aboriginal and Torres Strait Islander people, do have the opportunity or do actually go out and fish and walk and hunt. But actually, the people that were on our program, because they're on the bottom of the rung within their community, because of their mental health concerns, they actually don't go anywhere. They may walk to families' houses, but they actually almost are kept as prisoners, and that's themselves in their homes, not going out. So this was a real opportunity for them to actually get out again and seeing what it's like actually being out there in their environment. And because we were teaching language literacy and numeracy, we combined the teachings of what we had with the elements of nature. So as you can see people in the slide, one with a measuring tape in the top left-hand corner. The other ones that are on the beach are actually learning to write letters in the sand. And we found that embedding the learning in this way, the adaptation was a lot quicker. And what they were learning was then taken into the classroom so that they could actually embed the learnings out on country into actually writing, and they wrote little books out of this program. The other really important part of what we do is combining technology into these programs. And that's iPads, cameras, phones, whatever equipment we have, virtual reality equipment. We actually we teach them how to use this equipment. We also teach them the benefits of these equipment and what it can actually bring to their life and their journey. So as you see in these photos, they're actually doing video blogs of themselves, and they're actually filming each other with video logs. Then what they do is they're capturing their story first through telling it and recording it. And the last photo you'll see on the right-hand side is when they're in the classroom actually learning how to write their stories from what they've recorded. And it was a really, they really engaged in this process. They really leapfrogged their learning barriers by encompassing technology and their natural environment. And it was an amazing opportunity. Like, a lot of these people had never even touched a computer, let alone an iPad or a big video camera. But they all just really embellished the opportunity and moved forward, and their books and a lot of their stories were really personal stories. You know, and I would constantly read their stories, of course, to edit. And, you know, I'd say to them, to my team, you know, are they sure they want to put these stories through? But, you know, what had come back was this was their opportunity to heal from past hurts, to heal from the things that they've had happen to them, and to be able to move forward. And it was really encouraging to hear that. And, you know, people get shocked by using technology in this manner, of how it's not just teaching them to read and write, but it's that whole social and emotional well-being that's coming through, and that people are having the opportunity to do that. And this group is, you know, after this program, has since gone on to do amazing things. You know, we had 12 in the group, and 8 of them actually went on to go on to work, even though it wasn't an employment program. But because their hope had been lifted so much, their self-worth had been lifted so much, and they were actually starting to see that they had a future, and they could actually be really good at things that they were interested in. So we're really encouraged by that, you know, to have that type of outcome come out of these programs. So it's the heart of what we do, and it's the heart of what we are, is to help teach people overcoming. Another program that we have as well, we actually created a virtual reality experience project, because, you know, I go off myself. I had learning disability. I didn't complete school. I didn't even complete year 10. So there was no real hope for me until I started to learn things. And when I was introduced to technology, I thought, my gosh, this is going to change the way people perceive what their opportunities are in one aspect. So, and then the other point was, well, how do we get it out there? How do we get it to people who would never have the opportunity to actually experience this technology, to actually experience things outside of what they consider they only see in their lifestyle? So we did create 5 virtual reality experiences. We used live people. We filmed them in a studio and then created an environment. So one of our themes is mining. So you're actually on a mine site with the storyteller, them telling you the story, but trucks are going past. You know, you're in a really large excavator in the middle of a mine that they're digging, and everything is built to spec, so you're actually up really high and you experience all of these things. And what is coming out of it is people are going, well, I could drive that truck, or, for instance, in our health, well, I could be that doctor. Instead of actually thinking that they had no future, they're seeing these people and their stories about how they were able to achieve. And it's really related to them. It's really the children as young as 5, you know, 3 months later are still drawing what they saw in the virtual reality environment. And by building a truck like this, a bus, it actually goes everywhere. You know, there's not a place that's actually about to head off to the Northern Territory in Western Australia, but it goes to all different locations, and just to take the message out there. And I guess it's a message of hope, it's a message of aspiration. You know, it's all of the things that are encompassed for people to say, well, I can do that too. A couple of interesting statistics, and this is only internal statistics, this isn't a research project, of what we pulled out of people who've come through our virtual reality experience. It's really interesting, and what gauges me is in remote location, 85% of people still don't have a computer at home, and sometimes we take these things for granted. We have an extremely large digital divide with disadvantaged and marginalised groups. When you're looking at those statistics, if you're talking about Aboriginal and Torres Strait Islander people, that divide is almost double, tripled. One is low, you know, limited to no internet connectivity, but it's also not being introduced to technology, it's not being afraid of technology. There's all of those things that are involved, and these are one of the things that, apart from 100 other things, of course, that drive me, is to actually close that digital divide. We are in a digital revolution. There's no doubt about it. Everyone is going online. So we have to teach our people. We have to really help and support our people, our marginalised groups, to actually close that digital divide. Now, these are really interesting outcomes that we've seen as well from the virtual reality experience. As I mentioned before, people are engaging in what type of, job, career aspirations. Sometimes we set the bar so high because you'll see the great football stars, that'll come in and the kids or the students love that, and that's really good. But that's a tiny percentage of what an opportunity is. What we're trying to say, it's okay to look at other areas of work. It's okay you can be, if you're a football star, fantastic. But you know what? If you're not, that's okay too. There's other opportunities for you as well. People have actually come out of there actually going, that's why now I know why I want to work in the health industry, is because I want to help people. The doctor doesn't necessarily talk about being a doctor in virtual reality. He talks about why he wanted to help people. And it's given people clearer direction. Students who are completely disengaged from any system, completely kicked out of school, 2-3 schools, are actually engaging in this environment. But the really exciting thing is they actually want to learn as well how to build technology. So what we have in that team of virtual reality is 2 staff, 1 van, 8 virtual reality experience headsets, and actually today we've touched over 3,000 people's lives using advanced technology, and that's what's really exciting. I'm going to hand you over to David Swayn now to talk about his exploring futures with virtual reality. Thank you.
Thanks, Julianne. That was a great presentation and really inspiring. Before I hand over to David, just remind people we're going to have questions at the end of David's presentation. I note that there's Anne and others who have already posted some questions on the question pane, so I'd encourage you to take the opportunity to post those. Again, thank you, Julianne. Excuse me. David Swayn, it's my pleasure to introduce David. As I, at the beginning of the session, noted that David is the National Disability Coordination Officer for STEPS Group Australia. David in this presentation will share his extensive field experiences utilising virtual reality as an engagement tool for young people with a disability, specifically evaluating university as an option. This discussion will open your eyes to the need for alternative formats for engagement and their impact. He will provide an overview of the for-purpose distributed collaborative approach to solving a challenge across multiple competing organisations and how it works. Particularly looking at graduate employment for university students with disabilities. It's my pleasure to welcome you, David, to today's webinar.
Thanks, Anne, for the wonderful introduction, and Julianne as well. It's always a pleasure, and find ourselves on the David and Julianne show. It's a lot of fun. So to get started, I'll just start with sharing that we've created a virtual reality experience for people with disability to explore university. And it came out of necessity in a number of ways, and it also came out of looking for ways that are more accessible for all people with disabilities to evaluate university as an option, and what types of supports are available when you get there. How Julianne and I bumped paths was that last year I was on Thursday Island with a 30-kilo suitcase, a pull-up banner, a laptop bag, and a backpack. And there's a photo of me standing on the pier, which I wish I kept in this presentation, which sort of shares with you what it's like to get to a remote location to attend a career event or an expo when you've got information to share with young people and you want to take everything you can. And so I saw Julianne's team with their virtual reality experiences, and I had a go at it. And then after having a look at the technology and thinking, how can we utilise this to improve the work that I do, which is access to tertiary education, further education for people with disabilities, So Julianne and I had a conversation, and we decided that the best way forward was to work together and create a whole new experience, which was live filmed and which showcases university. So today we'll talk through a little bit about how that happened and what it means when you're standing out there at a career or transitions expo, and what the feedback is so far from the students as well. So this is a picture of my office in Townsville where I am now. These boxes are a little bit more empty because I've been on the road a little bit, but this represents a very significant volume of printing. They're wonderful, wonderful resources, but written resources aren't for everybody. And it's also very costly to produce on an annual basis. So, and then this is the virtual reality kit. I don't recommend, especially now, going through an airport with a kit like this. It's an interesting looking briefcase. So virtual reality for outreach activities, what we wanted to do was to make sure that we get the right information directly to the individual. And what this means is that we're not handing booklets to parents and we're not handing booklets to teachers, but the young person with disability gets to look for themselves and make an informed decision, which is quite a concept in a way. With virtual reality, there's some evidence at the moment demonstrating that your memory retention will be better, and you'll remember more of what you see in a virtual environment than you'll remember reading a book, for example. And also, and Julianne touched on, and we've had a long discussion about this, about accessibility for people with learning disability. And university also has routes of entry and accessibility options for people with learning disability. So we need to have the information reach individuals to be able to make the decision whether or not they can or can't go. And as we know, there's a significant volume of young people with diagnosis on the autism spectrum coming up through school. And so I want to make sure that it doesn't matter where you are in Queensland. Say, for example, you might be in Ingham, you might be in Cairns, you might be in Brisbane. You should have access to the same information and experience as anybody in a major centre, and this is one of the ways of getting that done. So the way that it works practically is that when I move around the region, I take it with me and I let people know I'm coming. And also Julianne has been so kind as to have it on her bus. So as that bus goes through remote communities, people in remote communities can experience university and actually be teleported from wherever they are all the way to James Cook University in Cairns. So it's 5 minutes. It shares information about adjustments and support available at university for people with disability. And 3 students came forward and shared their stories. And Jenna is one of the students who's pictured here with me. And she's an absolutely fabulous advocate for people with disability and is your guide through the experience. And in the end, it talks about if I can do it, you can do it too. And what that means is that people from disadvantaged and marginalised backgrounds often have an ingrained belief that it's not possible for them. And especially when it comes to accessing higher education, there's a long-term institution approach or a mentality which is being combated, which is about if you don't come from an upper middle class family, you can't go to university. So there's a lot of work in that space as well. But for people with disability, if you don't know what it's like when you get there, you might avoid it. And so we're trying to combat that. So who looks at it? I'm interested in everybody looking at it. So the way that I view this experience is it's not just for people with disability. You don't have to have a disability to have a go. And you'll learn about university life with or without disability. So we've had some really interesting experiences. And in the following slide, I'll share some of the survey data from about an hour of usage, and I took a screenshot on my phone because I was so fascinated with what I saw, and I think you will be too. But at a young age, I think you should have a look at this from maybe 12 up, and the idea is that allows you to plan your schooling accordingly. So pictured here is one of the students. His name's Caleb. Caleb has a diagnosis on the autism spectrum and was actually homeschooled. And for many reasons. And during his schooling, Caleb was, by very well-meaning people, informed that he was very unlikely to be able to get to university. And his family were wonderful advocates and supported him through the homeschooling process. and then he did an alternate entry into university, and is now completing a dual degree in languages with focus on Chinese and Japanese. A fabulous young man, and he's doing quite well. I wrote there the butterfly effect. In this particular instance, Caleb had a family who advocated for him and said to him, yes, it's possible. But I'd like to see that in more instances, young people with disability gain access to information like this in an accessible environment that allows the individual to make the decision and to believe that they can do it too. So this is a little bit of behind the scenes pictures through the development. On the top left here we have Julianne, who was very active during the day and helped out a lot, and a couple of the students, and we're just sitting there having a chat mid-break, I'd say. And then on the right-hand side we have the film day. So we all got together, did a pre-film briefing. We managed to film it in a day, and the post-production took about 2 months because it's quite an extensive process to put it all together. So far, this experience has been to Thursday Island, Cairns, Townsville, and it has been fantastic, absolutely fantastic. We are the coolest stop at the expo, unless Julianne's there, and her and I actually were at the same one in Cairns the other day, and both tables. So it was really, really great collaboration because I'm there to talk about tertiary access, and Julianne's there to talk about work. So putting our two tables side by side was an opportunity for all people to experience work and further education and be teleported elsewhere for a little while, and it went really, really well. So data. This is about an hour in to the Cairns event. I pulled out my phone and I saw how we were going. So yes, we have the VR, and the VR is fabulous, but it's really important to capture what it's doing and what it means. So practically speaking, I have an iPad. Once the individual has finished the experience, I'll either assist them through the questioning or I'll hand it to them to fill out the questioning. And it collects some data about, did the virtual reality experience meet its actual intent? And one of the questions I put in there, because I've had a couple of interesting conversations with various skeptics about interest in university. So the question would be, are people coming to have a look at this because they want to see VR, or and if they are they also interested in going to university? And it's a stronger balance towards interest in going to university than I thought, because of the emergency or the emergent nature of the technology. I expected that people who are not interested in university would also look, and we encourage honesty as well, total anonymity in response. So the other thing is about the tipping point, and I made mention of it a couple of slides back, and I didn't say anything, and that's because I want to talk about it right here. Virtual reality, has it reached the tipping point? And the tipping point is where a concept or a piece of technology goes just over that mound, where it's no longer a toy for innovators, and it's now a possibility for mainstream usage. So the people who filled out this small patch of data were in, I think, less than year 10. Less than year 10. So you've got young people, 58.8% have used VR before. So more than half, if that helps you with your organisational decision making, and I hope it does. So I think virtual reality has gone well beyond the tipping point now, and we'll see organisations using it for advertising, media. But I guess one of the things that we could talk about is intent of usage. So I would discourage creating virtual reality for the sake of creating virtual reality. Because if you're going to do it, you want it to meet a specific intent. So say, for example, Julianne's intent for the virtual reality is to reach out to remote communities, engage in technology and inspire, and it's achieving that. And this particular intent is to reach out to people with disability to explore university and see what's possible. And it's doing that. So if you are going to go down this route, think long term about what's it going to do and how do we want to measure it. And then, so we do all this work to work with people with disability to enter into university and further education, tertiary education. One of the things that Australia has a significant challenge with is graduate employment rates. So you'd like to think that if you went through the challenges and the difficulty of perhaps 4 years of higher education, that your employability would be increased by default. But for people with disability, that's not the case. The data suggests that comparative to people without disability, you would be twice as likely to be unemployed after. So at the moment, we have Disability Employment Services, which is a federally funded program, and it works with people with disability to enter into employment and maintain that employment. But that particular funding is not enabled to work with students in their final year. So we've created a partnership model, and this is just starting to happen, where we encourage providers who are funded to do this work to provide a consultant that works on campus with the university. And so what this does is it enables students to access a service in their final year when they need it the most. And in return, the providers get access to students who are graduating from university, and they can then engage with medium and large organisations, which they historically don't. So this particular concept, I think, is a relevant part of the conversation about the collaboration and the utilisation of technology for collaboration. So this partnership is set up in a cloud, and partners get access to working together to create the field manual. So each organisation with their different skills, the university, the provider and my program, work together to create the knowledge base. And with our collective knowledge and working in a collaborative environment, we can produce a greater impact than doing it ourselves. So I thought you might like to have a look at that. It started in Griffith, down on the Gold Coast, and it's about to begin at James Cook University, Townsville and Cairns. So quite groundbreaking stuff. Lots of hard work involved, but definitely a lot of fun as well. So I hope that gives a little bit of a practical overview of virtual reality in the field, and I hope that that inspires you somewhat to think about what you can do to engage with your audiences in a accessible format, and also actually speaking of accessibility, and I'm so proud to see that the team has organised captions for this webinar. It's wonderful. In the virtual reality experience we created, there's three things that are really important. The first thing we've managed to do is that inside the VR there's captions, so closed captions, which you can turn on or off, and there's also a pause button, and that's for breaks, sensory breaks specifically. So if someone's feeling overwhelmed, they can pause anywhere. So say, for example, they get to the library, they can stop all sound and all movement and just spend some time looking around, which allows the individual to acclimatise to the environment. The third thing that's important is Auslan. So for many people, English is a second language and Auslan is a first. So if you want a true accessibility in VR, you'd incorporate Auslan, you'd incorporate captions, you'd incorporate audio description. So people can still utilise the audio track if needed. And also consider if it's an overwhelming experience, or if it's an experience that is very full on, that the individual has a route to pause or to exit. So it's been a pleasure to have a chat. Our contact details are here, and also I'm sure that Anne will facilitate, but we're welcoming any questions of any nature and also suggestions. And Julianne and I are both avid LinkedIners, and we should see the little in there, so you're most welcome to find us and keep an eye on the work that we do. So thank you very much for having me, and I'll hand back over to you, Anne.
Thank you very much, David. Again, a great presentation, and great to hear that you and Julianne are doing such extensive collaboration, but good also to hear you're competing to be the coolest spot at conferences and events. And that would be no mean competition between the two of you, I suspect. We've been inundated by questions, so some of them are around technology. Anne has asked, do you use 4G, Julianne?
We do use 4G, but what we have done, because of the connectivity around the country, the app doesn't require internet. So it does produce user focus reports, but that can get backlogged. So it doesn't actually matter because the app doesn't require connectivity. which is a fantastic way to deliver technology, because as we know, connectivity is not great in every area. So I hope that answers the question.
Thanks, Julianne. We've got another technology question from Jenny. What specific technologies do you use, and particularly any specific software?
The virtual reality is created on the Unity platform, which seems to be the better platform to use when you're developing. So the current VR I talked about that I have was done through filming in a green room and animating the environment, whereas when we created the virtual reality for David, we used that with 360 GoPro cameras to film live action. So it's more of a real, you're actually seeing real footage rather than animated. And I would suggest if people are interested in building virtual reality, 360 filming is far more, is really engaging, and you're getting a lot more live footage. So
that's great, thank you. Question for you, David, from Imogen. Have you had discussions with all Queensland universities directly to provide tailored VR experiences for disabled individuals for each institution?
I haven't. The reason for that is money, because these are very expensive to produce. So what we did was, with the location of James Cook University, the content is quite generic, and that allows the discussions around accessibility for universities to be had on a larger scale than just in my region. So we did think of that angle and the need to make it more global. But to do one for each university, the university would need to fund it directly.
Thanks, David. A question from Harry for Julianne. Are you looking to expand the career options that you featured in the VR program?
Oh, definitely. The reason we chose those 5, we did win some funding from the federal government, and we chose those 5 because we thought, well, they have a varying range of different level type of jobs. But we definitely want to look at ways of creating more employment opportunities for people, because we are seeing the uptake within those areas of work from people looking at them in VR. So definitely we're going to be reaching out and talking to a lot more employers about coming on board as well.
That's great. I've got a question for, I think, both of you from Samantha. How long do people usually participate in your program?
I'll go first. So my virtual reality experience, the whole project goes between 1.5 to 2 hours. The virtual reality is 25 minutes. And the important part why it is so long is so we can have a pre-discussion. People go into the virtual reality experience, and then we have a post-discussion about what they saw and where they wanted to go. And my team actually helps people to transition, either putting them in contact with employers or putting them in contact with employment service providers, but also giving them the information that's required to go into those roles as well.
And for the virtual reality experience that we've made for focusing on university, we have had one person pull the headset off before the 5 minutes was finished out of probably about 130 so far. So it must be good. But much like Julianne, we provide referrals afterwards. So if the individual is interested in pursuing university as an avenue, we'll provide the options of universities of the area of their choice, and then some information on who to contact about accessibility and making a plan.
David, a question from another David. You talked about the importance of considering using Auslan, closed captioning and audio compiling. Scripting? Have I got the right terminology?
Just descriptions. So if there's pictures in something, it's important to provide a picture description for people that can't see the picture. And so, for example, in virtual reality, there would be one argument, which is that for people who are vision impaired, they cannot see the virtual reality. There is also an audio track, so it's a further accessible route that goes beyond the book. So if you are creating it, if the audio track describes what's happening, that's accessible as VR can be.
David comments on the cost of those. Do you have any ballpark figures in what it would cost to include each of those enhancements?
So it is costly to do, and it depends on the length of your production, and it also depends on how you'd incorporate that into virtual reality. So generally, you'll pay an hourly rate for captioning, and you'll pay an hourly rate for an Auslan translator. But if you were filming that, you would only do that once.
Terrific. Maybe we can talk to you further about promoting some of the options around there, David, given the importance of including those in all presentations.
That'd be fabulous, for sure.
I've got a couple of comments from Michelle, and I encourage people, it's probably your last opportunity to post on our website, and we've got probably about 4 more questions. Michelle has posted in relationship to your work, Julianne. She comments, exceptional work. Excuse me, exceptional work, Julianne, for working to break down the barriers of the digital divide. Also got a question from Sue, who's asking, have you got any particular strategies in which you could talk to participants of today's webinar in respect to breaking down the digital divide for Aboriginal and Torres Strait Islander people?
Yeah, absolutely. We, as a part of breaking down the digital divide, 9 weeks ago we launched DHive, which is an innovation hub, and a large part of that came out of talking to a lot of older people who weren't accessing the Tech Savvy Seniors program for a varied amount of reasons, you know, going into a library, transport, fear. So that between that, the digital divide, we launched DHive, and what we did was we created a different type of environment, a more relaxed environment, but instead of chucking people straight on the computer, we actually sat down and did a little exercise with them about what they actually wanted to get out of using a computer. What were they interested in learning, and what were their personal interests, and how can we tie those personal interests into teaching them on the computer. And as a result of that, we're overrun with people. They're coming in for all different types of reasonings. It's really interesting. I must show you this comment. People often, if they're in the employment world, people lose their resumes. They, you know, don't know where they are. They don't keep USBs, don't keep them updated. But, you know, the simplicity of teaching people about cloud-based applications, Google Drive, for instance, how, you know, they're always, these types of things like a resume is accessible in Google Drive, and, you know, that's actually not even on the scale for people about considering that. The other really important thing, especially if you're working with older people, is giving them safeguards, you know, encouraging them about keeping their information private, but how to safeguard themselves on the computer and on their phones as well, you know, because they are susceptible, and keeping the teaching simple, really simple. Don't make it overboard. If you're giving out handbooks, what we do when we write the text, we include Photoshop-like pictures of what they're looking at on the computer as well as the text, so that they can take them home and practice. We also encourage them if they have their own equipment, because we're finding a lot of people are giving their parents for presents or grandparents iPads and tablets. Now they don't know how to use them, so we encourage them to bring that in and actually use and learn from their own technology. So there's a few tips for you. There's very many different ways, but make it personal. Make it personal.
Thank you, Julianne. Good advice there. Time for one last comment, and it's again from Michelle. Thanks, Michelle, for posting these comments. It's directed to you, David. Now, Michelle says, thanks, David. Enjoyed your overview. I can see this happening around health services effectively. Do you want to comment on that, David?
I agree with you. Yeah, I think you need to see the engagement from people first trying VR to see the potential of it. And I've been surprised, and I'm a very open-minded person about possibility, but I've been surprised about the level of engagement, particularly from individuals who are non-verbal and individuals who I thought, and obviously I love being proven wrong, but I thought might experience some anxiety in using such a enclosed platform. So, you know, it goes on your head and, you know, you would expect that there might be a claustrophobic reaction. So in healthcare at the moment, there's some virtual reality experiences around surgery. But I think as far as, if you put your mind to the ability to teleport someone anywhere in the world. So for example, when we were on Thursday Island, we teleported young people 800 kilometers south. And, you know, some of these kids were screaming across the room, I'm in Cairns, and they haven't been to Cairns yet. So the applications in aged care and healthcare, and particularly for people who have been in a hospital bed for a long period of time, are wonderful.
That's great, David. That's probably all we've got time for in terms of questions today. I'd like to thank you both for your time today. Julianne, it's always a great pleasure to listen to your work and your experience and your passion for your community and your people. Thank you for attending today. David, it's great to also have I think young, emerging and enthusiastic players like yourself in our sector, and really testing out new bounds and providing some great inclusive experiences for people with a disability. Thank you both for being in attendance today.
Thank you,
Thank you, Anne.
Just another reminder, if you haven't formally registered, the registration details are on your site there. You can register for our free Community Care Smart Assistive Technology Collaborative at www.satcommunity.com.au. What's next for us? We'll be around Mount Isa, so I hope if any of our listeners today might be there. We've been travelling the state with Advanced Queensland on their Digital Skills for All Queenslanders Roadshow. Our next port of call is Mount Isa on the 28th of August. So we'd love if you, if anyone's in that region or anyone who knows anyone in that region to promote that event. We're also on the 25th of October doing another in our series of community care business transformation and innovation, following on from the highly successful conference we had in Brisbane at the beginning of June. This one will be concentrating on workforces of the future, so watch out for more details. We've got some upcoming webinars. On the 15th of August, we'll be focusing on developing living labs for community care, the opportunities for co-design and co-creation. On the 22nd of August, we'll be showcasing some of the ongoing work that Data 61 has been doing in the research area of innovative workforces of the future. And on the 12th of September, we'll be focusing on smart assistive technology and mental health issues for younger people. I'd like to acknowledge in closing today's webinar the Collaboratives project team led today by Imogen and Samantha, our project reference team who are voluntary inputs to the development of the collaboration. Importantly, the Queensland Government, who's provided funding for the ongoing functioning of the collaborative, and particularly again today's speakers, Julianne Lambourne and David Swayn. Thank you very much everyone for attending.